From the Punjab Medical Legal Agency, welcome. In this explainer, we're going to examine the core principles of forensic medicine. But we won't be approaching this as some abstract, theoretical science. Instead, we'll look at it as a practical discipline that holds absolutely vital lessons for every single medical professional and healthcare institution in their day-to-day practice. So here's how we've structured our discussion. First, we'll define the unique role of the forensic expert. Then we'll walk through their scientific process. After that, we'll get into the immense pressures they face, explore the very human element of their work, and finally, we'll wrap up by connecting all of this to the essential lessons this field holds for the entire medical community. All right, let's start at the very beginning. To really understand anything else, we first have to grasp the fundamental purpose of a forensic specialist. Their role is truly unlike any other in medicine. This quote, it really captures the absolute essence of the work. You see, while a clinician serves a living, breathing patient, a forensic doctor gives a voice to the deceased. Their entire training is about deciphering the silent, objective testimony that's written on the body itself, and then transforming those medical findings into hard, factual evidence for the courts. And this is what elevates the specialty beyond just medicine. It becomes a critical pillar of the justice system itself. The forensic expert's work provides the scientific bedrock upon which legal truths are built. This makes their function, quite frankly, indispensable to the fair administration of justice. So now that we know why they do it, let's look at how. Let's examine the rigorous scientific process that underpins every single forensic investigation. This methodical approach is designed for one thing: to eliminate ambiguity and deliver objective truth. And right here, you see a fundamental shift in duty. In clinical practice, your duty is always to the patient. But in forensic practice, your primary duty is to the justice system. And that distinction, it changes everything. It changes the questions you ask, the way you document your findings, everything. The goal isn't treatment anymore. The goal is establishing irrefutable fact. This workflow isn't a suggestion. It's a non-negotiable protocol. Each step you see here, from the first look to the final report, is a critical link in a chain of evidence. Any deviation, any undocumented action can completely compromise the entire case in court. So you have to understand, strict adherence to this systematic procedure is the single strongest defense against medical legal error. Now, this whole scientific process is protected by something just as important: an unwavering ethical code. Because at the end of the day, the science is only as strong as the integrity of the person conducting it. And let's be clear, this is not some hypothetical question. This is a daily reality in medical legal work. And the answer to this question literally determines whether the justice system functions or fails. Forensic experts consistently face incredible pressures, all designed to warp their scientific conclusions. These influences can be political, they can be financial, they can be social, but they all share the exact same goal: to substitute the objective truth with someone's preferred narrative. Resisting these pressures isn't just a good idea, it's a core competency of the profession. And that's why the forensic report must be treated as sacred ground. Think of it as an island of pure, unbiased science in a sea of opinions and agendas. In this context, moral courage and professional integrity, well, they aren't abstract virtues. They are essential, practical tools required to do the job right. Okay, so beyond the cold, hard science and the high-stakes ethics, there is a profound human dimension to this work, and it holds lessons for every single one of us in healthcare. Professional detachment is a critical skill. It's not a lack of empathy, far from it. It is the trained ability to function effectively right in the middle of tragedy, ensuring that your own emotional responses don't cloud your scientific judgment. This is a discipline that's necessary for anyone who deals with human suffering, whether you're in a mortuary or a hospital ward. And even with that professional detachment, the ethical duty to treat the deceased with absolute respect remains paramount. This commitment to dignity, it has to persist no matter the systemic challenges or difficult circumstances. It's a powerful reminder that every single person deserves sanctuary, both in life and in death. So finally, let's bring all of this home. Let's connect these forensic principles directly to the day-to-day realities of clinical and administrative practice. This is where the lessons become immediately useful in your own work. This statement right here represents our guiding philosophy. Clinical errors are rare, medical legal errors are routine. Think about that. A surgeon very rarely makes a technical mistake with a scalpel, but a failure to properly document consent, an incomplete medical record, a breakdown in communication between shifts, these are the medical legal errors that happen every single day, and you have to see them for what they are: system failures, not failures of clinical skill. The solution, then, is to start adopting a forensic mindset in your clinical practice. The very same principles that uphold justice in a courtroom are the ones that can protect practitioners and patients inside a hospital. Rigorous documentation isn't just paperwork, it's your primary defense. And ethical resilience isn't just for some high-profile case, it's essential for every clinical decision you make. So we'll leave you with this question to really consider in your own practice. Start thinking of your documentation not just as a record of what you did, but as the final testimony you would give in a court of law. Because by embedding these principles, objectivity, diligence, integrity, into your daily systems, you build a powerful shield against medical legal risk. And in doing so, you protect your patients, you protect your colleagues, and you protect your institution.